Hello juniors, so I welcome you all in the series of upper limb, and in today's video we are going to cover axilla. This is the model taken from BDC. This imitates the axilla. So with the help of this model we will be doing axilla, studying axilla. So in today's topic we will be covering boundaries, walls forming and content of axilla. Basically these two are same, so boundaries and wall formation are same. Showing you on my axilla is armpit. In layman language, axilla is armpit. This is armpit. This one is anterior axillary fold. This one is anterior axillary fold, and this one is posterior axillary fold. Axilla is armpit. This is anterior axillary fold. This is posterior axillary fold. So with the help of this app, I'll be showing you the walls forming the axilla. Firstly, in this model we have our anterior side, posterior side, medial side and lateral side. This is apex, this is floor. So let me show you how it is. So in this way, axilla is represented in this way. Can you appreciate this? This side is anterior, this is medial, this is lateral, and behind is posterior. Going through the first apex. So many students confuse in apex. Apex also forms cervico-axillary canal. What is cervico-axillary canal? Let me again show you. In this model, I have kept only clavicle, scapula and first rib. Clavicle, scapula, first rib. Showing you from the top view. This thing. Can you see this? A little triangle. Almost a triangle. This way. This root between scapula, clavicle and first rib forms the cervico-axillary canal. As the name suggests, it goes from cervical to the axilla. And let me show you this way. Hiding clavicle. Clavicle is in front of the clavicle, forms the anterior border of cervico-axillary canal. So cervico-axillary canal is backwards from scapula. From anterior side it is from clavicle, and from medially it is by first rib. Apex or cervico-axillary canal truncated. So this is truncated, non-pointed. Corresponds to a triangular interval. Right here we have seen. This is almost a triangle. So the passage that goes downward in between the clavicle and the scapula medially by first rib corresponds to cervico-axillary canal. Anteriorly by posterior surface of clavicle. Anteriorly by posterior surface of clavicle This is our clavicle posterior surface from backward. Posterior surface of clavicle. Medially by outer border of first rib. As said earlier, this is outer border of first rib. This is our first rib. This. And posteriorly by superior border of scapula. This is our superior border of scapula. Let me show you once again. This is superior border of scapula, outer border of first rib, and posterior border of clavicle. It forms the cervico-axillary canal. So the contents are axillary vessels and brachial plexus enters through it. Axillary vessels contain axillary artery and axillary vein, of course, and brachial plexus. In my brachial plexus, I have covered the contents of brachial plexus behind the clavicle. So the contents behind the clavicle are also in cervico-axillary canal. Now, anterior wall. This. Again showing you with the help of diagram. This muscle. This whole muscle forms the like this. So this is behind this muscle. Anterior axillary wall is formed by pectoralis major. Can you see this? This whole muscle is pectoralis major, which forms the anterior border of this. Pectoralis major is above this. So pectoralis major, this muscle is pectoralis minor. So our anterior wall is formed by pectoralis major, pectoralis minor, this, and clavipectoral fascia. For clavipectoral fascia, refer to my clavipectoral fascia video. Clavipectoral fascia, in short, I say, this is the fascia which starts from clavicle and then covers the subclavicle muscle. That is clavipectoral fascia. So we are done with the anterior wall. Now seeing the posterior wall. Right here by this view, this is now we have removed our anterior walls, that is pectoralis major and minor, and our axilla seems to be like this. So our posterior wall is formed by subscapularis muscle. This whole muscle is subscapularis muscle. This one. This is subscapularis muscle. Teres minor. This is teres major. This is teres major. These muscle forms the posterior wall, and last one is the latissimus dorsi. This muscle. This forms the posterior wall of axilla. Once again with me. Subscapularis, teres major, and latissimus dorsi. These forms the posterior wall of axilla. Are you clear with that? Now doing the medial wall. In this video, in this image itself, we can see the medial wall is formed by upper four ribs. 1, 2, 3, 4 upper four ribs and their intercostal muscle. 1, 2, 3, 4 upper four ribs and their intercostal muscle. Second by upper part of serratus anterior. This is serratus anterior. Upper part of serratus anterior forms the medial wall of axilla. So there is nothing to explain in this. You can see the diagram, and by just seeing the diagram you can tell the medial, anterior and posterior walls of axilla. Last one is this lateral wall. Lateral wall, this is very narrow. In this diagram I'll show you the lateral wall. Lateral wall is very narrow and is formed by upper shaft of humerus. This is humerus, this is head of humerus, this is upper shaft of humerus. This is formed by this way. This is formed by our upper shaft of humerus and coracobrachialis. This is coracobrachialis. This one designated as 1, coracobrachialis, and short head. This is short head of biceps brachii. So these muscles, coracobrachialis, short head of biceps brachii, forms the lateral wall of axilla. Now we are done with walls of axilla. Contents of axilla. Again showing you another diagram. So with the help of these diagrams we are almost doing nothing but just seeing our diagram carefully and noting down the wall formation by those muscles. So this is the view of axilla. This is our anterior. This side is our anterior, this side is our posterior. So as said, anterior wall is formed by pectoralis major. This is pectoralis major, this is anterior side, this is posterior side. We won't be able to see lateral and medial walls by this diagram. This is pectoralis major, pectoralis minor, and this one is clavipectoral fascia. Go through my clavipectoral fascia video to understand this fascia. Posterior wall is formed by subscapularis, teres major and latissimus dorsi. See, all we are doing is just seeing the diagram and noting down the walls formation. So it becomes very easy. Now this diagram is again taken from BDC. This is the view from, let me show you. This is our first rib, humerus and scapula. Let me show you our view. This is the view from the top. This is our humerus, scapula, and here it is the first rib. Same we have taken here, humerus, scapula, first rib. So as said earlier, anterior wall is formed by pectoralis minor and major anterior wall. Lateral wall is formed by coracobrachialis, short head of biceps brachii. Here long head of biceps brachii. No, it is not involved in formation of axilla. Instead, in lateral wall there was shaft of humerus. Coracobrachialis, short head of biceps brachii and shaft of humerus. Medial wall is formed by serratus anterior. This is medial wall. This is medial. This is lateral. This is anterior and this is posterior. Medial wall is formed by serratus anterior. And posterior wall, here it is latissimus dorsi. This is latissimus dorsi muscle. This is teres major muscle and this is subscapularis muscle. So all these are covered in a diagram. If you draw this one of these diagram in your university exam and just label them all correctly, you would be getting sufficient marks by doing this method, by applying this method. So coming to contents of axilla. Axillary artery and its branches. This is our axillary artery and its branches. Axillary vein, infraclavicular part of brachial plexus. See the part below the clavicle, it is in the content of axilla. So the part below the clavicle of brachial plexus comes in the contents of axilla. Group of lymph node, these are the group of lymph node. We are done with axillary artery, axillary vein, group of lymph node, and long thoracic nerve. Let me show you long thoracic nerve. No, it is not depicted in this long thoracic nerve. So majorly these 5 are the contents of axilla. I hope you understand this. This is our axillary artery, axillary vein, axillary group of lymph nodes, these 3. Originally there are 5 group of lymph nodes, but here there are depicted only 3. Infraclavicular part of brachial plexus and long thoracic nerve. Now we are left with our clinical anatomy. Axilla has abundant axillary hair. Infection of hair follicles and sebaceous glands give rise to axillary boils. This is axilla. Axilla has abundant axillary hair. Infection to hair follicles give rise to axillary boils. These boils are very painful because axilla has a high nerve supply, and because of that any infection or any axillary boil is very painful. So I hope this video might be helpful for you. We are done with boundaries, wall forming, content of axilla, and also clinical anatomy. I hope this video was a bit helpful for you in your university exam. Thank you.